Hello friends, welcome to my channel. I'm Dr. Geeta Iyengar, retired professor in sociology and psychology. Well, today I thought let's examine some of the case studies of people who are facing phobias. You know what is phobia? All of us know it's an anxiety disorder. We are afraid of a lot of things. We are scared of a lot of things. There is so much of fear in us, little fears, big fears, and so on. And sometimes we realize how to help them. Why are they going through this fear? What is this phobia? Let me tell you a case of a middle aged woman. I think she was 45 and she was so afraid of closed things. She could not stay in a place, open space. So she never liked anything open. So she never wanted an open area. So she always would lock her bedroom and sleep. There's another case of a woman who was scared. She was claustrophobia. She could not stand enclosed place. So like for example, if you want to travel in a lift or if you want to be in a small room, many times she didn't even want to use a toilet because the room toilet because she was so afraid of the small space. So some people have fear of space, some have fear of water, that is deep water. Some have fear for heights, some have fear for animals, some have fear for situations, and some are afraid of activities. But if you analyze this, like for example, there is a person, she used to always, she became very old, she couldn't even walk properly. She refused to sleep on the ground floor. She slept on the upper first floor, and her caretaker would go every morning and bring her down. And when she was asked, she said, somehow I feel there is one tiger sitting downstairs and he will eat me up. She had this fear for a long time and she was going through therapy for that. There is a case, some people who can't stand animals. They're afraid of different animals, small things like we also have fear of rats, cats, or dogs, and so on. And there are some people who have called they cannot stand crowd. There was one lady who, when she went to a shopping mall, she would really start sweating because in the mall she saw a lot of mirrors and she felt that all people are staring at her. Then there are cases of people who can't stand crowd like the cinema hall. They always have the fear that there's going to be a stampede. There are people who tremble at the local train. A case of a woman who would go all the way to the local train. The minute the train arrived, she just would shut her ears, put her head down, and wanted the train to go away. These are very sad situations. We have to understand how to make these people deal with such situations. There are also people who suffer from popularly known as what is called banana phobia. The smell of ripe banana puts them off. There are some people who cannot stand blood, some who cannot stand vomit. There are different kinds of phobias. So what are the cause? Why does it happen? There are, for example, I myself was so scared. Even today I'm scared of the escalator because sometime I had fallen from there. So when you examine it, you find they have a past history. People must have been drowned in the water, or their lift must have stuck sometimes, or there is, even today I know one lady who locks her room. She puts double lock because she's afraid that the tall people are standing outside her door, so she's so scared. So these are all different kinds of phobias which we find in normal people. But then the only way we can treat or we can solve this issue is that make them gradually face the situation. How best to make them face? Every day they have to see the situation, every day they have to, like somebody is afraid of water, take them into the water, slowly allow them to touch the water, feel the water. One day they will come out of it, of this fear. Similarly, heights. We have to deal with them, and it is not a difficult thing. It's not impossible. It is difficult, but you can definitely solve it. So like that, there are so many cases we find. So we should not make fun of them. most of the time we say, oh my God, she's so afraid of this. There is a reason. Like I told you, it may be a past experience. It may be sometimes they've gone to past birth also. Why? There is no reason, for no reason you're afraid of something. Suppose you are bitten by a snake. Even today you're afraid of snake. Somebody was bitten by a dog when they were young. It affects them now as an adult. So sometimes childhood experiences also are responsible for our present behavior. So we have to look into so many categories and factors before we come to the conclusion that these are people who are nervous, these are people who are tensed, because they are normal people like us. They must have gone through something in their past or in their childhood, and that is the repercussions is all that you see now in the present. So what is necessary is sympathetic understanding, and try, instead of fearing or rather scaring them more, understand them in their space. Because see, there are people with space phobias, water phobias, banana phobias, different kind of fears are there. Every day we are going through that. They can come out of it. There are so many therapies now, and it doesn't mean they're abnormal. My whole idea of telling is they're normal people like us. All of us have some fear. The only thing is each one of us can become a therapist and help them to come out of it. Of course, there are many stories like that which I might touch upon later in the what you call classification of illusion and hallucination. I hope I'm able to throw some light on this aspect of phobias. And thank you so much for listening to me. And welcome again. I want all of you to come back, and if you ring the bell icon and comment, if you have any other suggestions, then I would be very happy to hear from you also. I hope you enjoyed my reflections on how to deal with people who have these phobias and fears, which can be helped by a near and dear ones. So thank you once again, and see you next time.